Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The National Drug Agency for Food and Drug Administration and Control, NAFDAC, approves Oxford AstraZeneca Vaccine for use in Nigeria. A robot designed by Nigerian students could make nursing and drug dispensing easier for health workers. And just like Zimbabwe, Senegal, another country in Africa, gets the China-manufactured vaccine from Sinopharm. More cases of the coronavirus have been recorded, and these numbers came in last night, significantly lower than the previous day of over 1,300 cases. According to the Nigeria Center for Disease Control, 869 new cases were confirmed and 8 deaths. The new cases are reported from 23 states and the Federal Capital Territory, with Lagos topping the list, followed by Rivers, Taraba, Oyo, Ogun, the FCT, Plateau, Kwara, Ondo, Osun, which registered 24 cases, Kano 22, Nasarawa 21, Abia 19 cases, same with Edo and Akwa Ibom states. While 10 cases were registered in Cross River, Delta recorded 9, 8 in Benue, 6 in Ekiti State, 6 as well in Borno, while 4 were recorded in Katsina, 3 in Bauchi, Bayelsa and Zamfara states recorded 1 each. While data from Taraba State, according to the center, were reported over the last 3 days. Till date, 149,369 cases have been confirmed. Community recoveries were also recorded in Lagos State, 70 in Plateau, and 28 recoveries in Benue, pushing total number of those discharged to over 125,000. Meanwhile, there are nearly 24,000 patients still receiving treatment in isolation centers, and total tests carried out across the country are over 1.4 million. Now, following the declaration of Ebola virus disease, EVD, outbreak in Guinea, the Nigeria Center for Disease Control is placing Nigeria on moderate risk of an EVD outbreak. In its public health advisory, which was published today, the center explains that using the proximity of Guinea to Nigeria and other West African countries, as well as other indicators, several measures are in place to prevent and mitigate the impact of a potential outbreak in the country. The National Agency for Food and Drug Administration and Control, NAFDAC, has approved the use of AstraZeneca vaccine to fight COVID-19 in Nigeria. The WHO recently gave the go-ahead on the vaccine for emergency use, and NAFDAC says its safety committee has carried out an evaluation after it got the dossier a week ago to affirm its safety and efficacy for Nigerians. The Director General of NAFDAC further explains that there are 3 other additional vaccines undergoing assessment.
This is to announce that our first COVID vaccine, AstraZeneca Oxford COVID-19 vaccine, also called Covishield, has just been granted emergency use authorization by NAFDAC. The emergency use listing will allow Nigeria to receive the first batch of the vaccine from COVAX facility within weeks, subject to approval by NAFDAC. The recommendation for emergency use authorization of COVID-19 vaccine from AstraZeneca or through Serum Institute, it is also called Covishield, was based on rigorous scientific considerations as summarized below. 1, vaccine quality. We have to ascertain that the vaccine has quality. We also looked at vaccine safety and efficacy. This is extremely important because safety and efficacy are premium to us as regulatory agency, NAFDAC. Our goal is to safeguard the health of our people. NAFDAC received the AstraZeneca Oxford COVID-19 vaccine dossier from Serum Institute of India on February 10, 2021, which was last week.
Well, more of the considerations from NAFDAC, apart from the fact that the Oxford AstraZeneca vaccine can also be called COVID-Shield. It's manufactured from Serum Institute of India. The NAFDAC Vaccine Committee also highlighted the following, that the multi-dose, 2-dose or 10-dose vial is stored at 2 to 80 degrees Celsius, and that the drug product shelf life is of 6 months. On its vaccine safety and efficacy from the phases conducted, NAFDAC says the AstraZeneca Oxford or COVID-Shield was found safe and well tolerated in adults above 18 years of age. Now, even though human trials for its safety in children are currently ongoing, and this is according to manufacturers. Meanwhile, Edo State government is preparing to receive the approved COVID-19 vaccines and says they will ensure the distribution is based on recommendation by health officials. The permanent secretary in the State Ministry of Health, Dr. Osamoyi Irowa, disclosed this during the daily COVID-19 response team's briefing in Benin City, the state capital. Dr. Irowa insists that enforcement remains one of the key pillars in the fight to curb the spread of the pandemic. He added that some places which were shut down for violation of the COVID-19 protocols will remain closed until they meet the required standards.
Efforts are also being put in place to prepare for the possibility of vaccines coming to Edo State. And once the vaccines come in, the due processes and protocols that will be defined will give us information as how the vaccine will be distributed equitably. And we expect that this will be based on priority, based on the fact that those at most risk will be given this vaccine, possibly first, before other persons. And we are preparing the ground for us to receive vaccines once they are made available to the states. Enforcement is one of the measures we are putting more effort into to ensure that people comply with the protocols already defined in Edo State. As you would have heard, some settings were shut down yesterday because they were not complying with the protocols. And they've been made to comply immediately, otherwise their facilities will not be opened.
An infectious disease specialist, Dr. Abdul Jalil Balewa, joins us now from our Abuja studios to talk some more about some of the latest trends on the coronavirus pandemic. We'd like to thank you for joining us on the program. First, let's get your thoughts on NAFDAC's announcements, the COVID-Shield certified for use in Nigeria. Are you optimistic that this is a good step in curtailing the spread?
I cannot say I agree totally. Anything good for my people is good, but we need to actually test ourselves and make sure that it is good for our population. There are so many things that's happening, so many different variants and so many strains, and we actually don't know if it will work as well for us as has been promoted.
But NAFDAC has given the go-ahead.
Yes, it has been given go-ahead. A lot of things get go-ahead in Nigeria without proper testing. We just seem to be the world's guinea pigs sometimes. But I'm sure that NAFDAC will do its damnness to make sure that our people will not be in harm's way.
What's your take on the arguments that the variants identified in many countries and the contagion might render some of the treatments and even the vaccines less effective?
We need to understand the difference between variants and strains. Variants are those with the same genome that do react basically to a particular drug or vaccine. Strains are totally different. They like the South African strain that evades the vaccine is a strain. It's not a variant. And we need to understand what we have. There are 38 cases that the UK has identified as Nigerian variants. But what have we done? What sequencing have we done? We've seen clinical differences in Nigeria, but we have not had any papers published by our CDC or any of its labs. But we know that in the hospitals now, the mortality is much higher. That is one. Secondly, it's combined with a lot of bleeding. Bleeding from the nose, from the ears, and from the stool. Now, one thing we should also consider is the fact that we have a yellow fever epidemic of sorts in Nigeria, especially in northern Nigeria and parts of the south. Now, some of the symptoms are very similar. Are these variants strains, or are they combinations of these viruses? For instance, the arbovirus or flavivirus that yellow fever belongs to have these types of indications. We need to really know what we're doing, but we're not hearing from CDC. We have these television shows every day whereby you have ministers and some people from different parts. Nobody is telling us what is actually here in Nigeria. We seem to follow whatever we're told by the West. And this COVID itself is such a strange ailment that any time you try to delve into its origins or some of the pathways of mutation, you come to dead ends. It's very, very strange.
So we still have quite a lot on our hands. But I wanted to quickly get your thoughts, and this is as regards the preventive measures. Apart from the non-pharmaceutical protocols, the pharmaceutical markets are seeing a high demand for zinc and vitamin C and vitamin D as well. But is there available evidence that confirms that, some of these drugs boost immunity against the coronavirus?
We need to understand what these things do. The zinc, the metal itself, what it does is that it inhibits the production or the functioning of TMP-RSS, an enzyme called TMP-RSS, or the ACE2 enzyme, which are responsible for the cleavage of those spikes from the virus. And it also helps in that the pH, when zinc is around, the pH is raised high. When you have a high pH environment in the media, the TMP-RSS, the enzyme, and even CAT-L don't function well. So when you have zinc, the chances of adhesion or permanent entry into a cell is limited. It also reduces the production of endosomes, which is a capsule on the outside of a cell, which when these enzymes like cathepsin L come into the media, will allow the entry and then emptying the viral particle into the cell. That is one. For vitamin C has always worked very well in any time you need some healing. What it does is that it works synergistically with some of the other compounds that helps in healing. Vitamin D is different in that it allows the excretion or allows the coming into the cellular media magnesium and calcium, which are alkaline metals, which raises also the pH of the media. And whenever the pH is raised, a lot of those enzymes, like ACE2 or TMPRSS,
we would have to leave it there and
so
hope that you can come again.
It may not help.
Finally,
pardon me?
Go ahead. Finally, go ahead, just because we need to go. Finally.
Oh, okay. See, vitamin D may not help in healing. Okay. But can just reduce the complications. So they're not unhelpful.
All right. We appreciate your time. Thank you so much. We will definitely have you again. Infectious diseases expert, Dr. Abdul Jalil Balewa. Thank you for joining us on the program.
Thank you for having me.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. A group of students in Nigeria have built a robot they hope can one day help hospitals remotely treat COVID-19 patients. According to the students, the machine, wrapped in Ankara prints, can help take temperatures, transport medicine, and also allow medical workers communicate with patients via a webcam and screen.
The robot is a remote-controlled cabinet on wheels, decked out with a vibrant floral pattern and dubbed My Robot. In a demonstration, a school nurse loads My Robot with medicine and, using a controller and goggles to see through a camera, trundles the machine through a corridor and into a mock isolation room to scan a student's forehead for her temperature.
We tried to figure out a solution to that particular problem, because without the healthcare workers, who would be the people taking care of COVID-19 patients? So My Robot was born because we were looking for a way to reduce the physical contact between healthcare workers and infected COVID-19 patients.
But My Robot, which took about 3 months to build, is still in its early days. During the demonstration, the isolation room door had to be left open for it, and it can only carry medication, so patients would self-administer while a nurse watches over the camera. David Adeniyi is a teacher overseeing the robotics team. He says the students hope to make My Robot commercially available one day.
We are working on upgrading of My Robot to meet up to international standard, whereby when you see it, you can put your money on it and buy it.
For the students, the robot's use will not stop at the coronavirus. One doctor at an isolation and treatment center in Abuja praises the innovation.
Getting to hear patients' complaints, deliveries of certain medications, and limiting the duration of time and the frequency that health workers have to be with patients like COVID-19 patients at this time. So yes, it's ingenious, it's useful, it's something that I think should receive a lot of support.
The robotics team at the Glisten International Academy in Nigeria's capital, Abuja, started out trying to build My Robot by collaborating online, but eventually had to come together to finish the project in their lab.
That is just amazing. Well, let's go over to Abuja studios. We have Dr. Arome Adejo. He's the first Vice President, Nigeria Association of Resident Doctors, NARD. Thank you for joining us on the program as we talk doctors' welfare. Let me first ask, tell us about the latest, especially with NARD and doctors' welfare at the moment.
Good evening, everyone. Thank you for having me. Well, at the moment, NARD is trying hard to discourage its members from going outside, you know, in terms of brain drain. And that's why we are going into the NARD housing project. And at the moment, NARD is trying very hard to beg the federal government to pay the house officers their January salary. And at the moment, NARD is also trying very hard to talk to the federal government to conclude their plans about the hazard allowance, because it's causing a lot of crisis in our association.
It's interesting to note that several other countries, France, the UK, for example, has a special visa for health workers and, you know, coming into the country. And, you know, this is not to say, I'm sure there are some Nigerian health workers who have already departed or are planning to. But looking at the Nigerian situation, what is the government saying in terms of projects, in terms of drive to really improve the health workers' welfare?
All right. Well, it's so bad that Nigerian doctors now are moving to any available countries. And it's so very bad that these countries now, they are making things easy for our doctors to come over. Nigerian, we can move to any place, even Ghana right now. Is very bad. Well, for now, I don't see anything meaningful that the government is doing to discourage brain drain. But we, on our part, we have been trying as much as possible to bring to their own attention what is really pushing our members outside. Number one is the welfare. We have been talking about this over and over again. As I said earlier, our hazard allowance is 5,000 naira. And this 5,000 naira is even taxed. There is no insurance. In the past 3 weeks, we've lost 2 of our members, and there is no insurance. That is very bad. If I die now, my kids, my wife would not be taken care of. That is bad. That will even make us to even run away. And apart from that, the training of doctors in Nigeria, the postgraduate training is very frustrating. And that's why we have been asking them to look into the act establishing the postgraduate school. This act has been there since 1979. It is obsolete. When other clients are going on with the current trends, we are still stagnant, remaining where we are. It is bad. And some doctors that are very sick, they don't even have money to take care of themselves. When you see your mate that is sick, begging for harm so as to take care of himself, you yourself, you will not be encouraged, because your take-home pay is not even enough not to talk of saving for the remaining day. And that will bring us to the and that will bring me to even talk on the issue of health insurance. I believe every Nigerian, not even we alone, should be entitled to health insurance.
Indeed, serious issues. Thank you so much, Dr. Arome Adejo, the first Vice President with NARD. Thank you for joining us on the program.
Thank you, ma'am. Thank you for having me.
Senegal has received 200,000 doses of the COVID-19 vaccine from Chinese company Sinopharm. President Macky Sall said the government bought the vaccine and did not wait to receive doses from the WHO's COVAX scheme, which aims to make it easier for developing nations to buy them. Frontline health workers, the elderly and people with underlying health conditions are first in line for the shot. Mr. Sall said that Senegal aimed to get another 6.5 million doses in the coming weeks to widen its vaccination campaign. Continue to take responsibility. Visit our website. It's channelstv.com for more updates and a better understanding of the pandemic. Plus, you can find other stories as well, all at your fingertips. That's the COVID-19 update program. Thank you for watching. I'm Millicent Walker. Stay safe.